Good morning, all. Am I audible? Great. Good morning. So we are starting with prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. Giving tribute to our great master Samuel Hahnemann, who have found this divine science and taught us dare to be wise. Seeking blessings from our great Guru, Dr. Prafull Vijayakar, sirs, who have made this divine science and combine with the modern science and make homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijaykaraya Namah. So friends, we are in the journey of reading. We are in the journey of reading Organon, few aphorisms, and the book, The End of My Assumptions of Miasm by Dr. Prafull Vijayakar. So up till now in Organon, we have read about the benefits of the homeopathy and the things what antipathy mode of treatment do. So today we are reading the aphorism number 57. In order to carry into practice these antipathic methods, the ordinary physician gives for a single troublesome symptom from amongst the many other symptoms of the disease, which he passes by unheeded a medicine concerning which it is known that it produced the exact opposite of the morbid symptoms thought to be subdued, from which, agreeably to the 15th century old traditional rules of the antiquated medical school, contraria contraris, he can expect the speediest, the palliative relief. He gives large doses of opium for the pains of all sorts because this drug soon benumb the sensibility, and administer the same remedy for the diarrhea because it speedily puts a stop to the peristaltic motions of the intestinal canal and make it insensible, and also for the sleeplessness because opium readily produces a stupefied comatose sleep. He gives purgatives when the patient has suffered long from the constipation and costiveness. He causes the burnt hand to be plunged into cold water, which from its low degree of temperature seems intentionally to remove the burning pain as if by the magic. He put the patient who complain of chilliness and deficiency of heat into warm bath, which warm him immediately. He makes him who is suffering from the prolonged debility drink wine, whereby he is instantly enlivened and refreshed. And in a like manner, he employ other opposite the antipathic remedial means. But he has a very few beside those just mentioned, as it is only for a few substances that some peculiar the primary action is known to the ordinary medical school. Though they just believe in the physiological actions of the medicines that is primarily acting on the human system. But how the secondary actions of the vital force or our immune system reacting to that primary substance, they don't know. Aphorism number 58 says that in estimating the value of this mode of employing medicines, if we should even pass over the circumstances, that is an extremely faulty symptomatic treatment. This is something which we call as faulty symptomatic treatment. What Hahnemann is said about this is the antipathic mode of treatment is the faulty symptomatic treatment, wherein the practitioner devoted his attention in merely one-sided manner to a single symptom. So most of time the patient comes to us with to the allopathic doctor. They say that if there is a fever, they give an antipyretic. If there is some bacterial infection, they give an antibacterial. So this is what a one-sided manner to the single symptoms consequently to only a small part of the whole, whereby relief for the totality of the disease, which is what the patient desire, cannot evidently be expected. We must, on the other hand, demand of experience if, in one single case, where such antipathic employment of the medicine was made use of in a chronic or persisting affections. After the transient ameliorations, there did not ensue an increased aggravations of the symptoms. So this is what very important aspect of understanding, which was subdued at first in a palliative manner, an aggravation indeed of the whole disease. And every attentive observer will agree that after such short antipathic ameliorations, aggravation follow in every case without exceptions. Although the ordinary physician is in the habit of giving his patients another explanation of this subsequent aggravation and ascribe it to the malignancy of the original disease. So they said that it is not the aggravations after medicine, but it is something that is the progress of the disease. Now, for the first time, showing itself or to the occurrence of a quite new disease. So what footnote number 64 says that little as a physician have hitherto been in a habit of observing accurately the aggravations that so certainly follow, such palliative treatment could not altogether escape their notice. They also notice, this is what the example was given by Master Hahnemann with the quoting of that page number and everything. And that experience says that wine and the cordial given to a weak increase the actions without giving real strength, and the power of body are afterward sunk proportionally as they have been raised, by which nothing can be gained but the great deal may be lost. So this is what the antibiotic mode of treatment will not be given. So, friends, we are reading this aphorism from the Master. So, Master's wisdom will help us to understand what Master is telling to us and what Vijayakar sir is telling, that we have to correlate that olden science with the modern science, and then we have to put into our actions. So, friends, we are reading the book End of My Assumptions of Miasm. So up till now we have learned about the miasms are the three in nature. The three nature of the miasm is divided on the basis of the cellular mechanisms of the cells and the survival mechanism of the cells. The first functions of the cell is to survive for the self, and for that survival they want a nutrition and the respiration. So this is what the survival of the self. Then after that survival, the cell requires reproductions. So the second function is of a reproduction, and the third function that the hostile force is acting on the cells and to degrade it so that they have to defend in terms of, and that is what represent at the physical level in the form of the primary physiological response, the secondary morphological constructive response, and secondary morphological destructive response in terms of sora, psychosis, and syphilis. They produce symptoms in the form of inflammations as a primary response. In the secondary constructive response, it produces either a excess reproductions or a less reproductions in the forms of accumulations, reposition, synthesis, or the proliferations. And the third process is the secondary morphological destructive defense in the forms of either a necrosis or the apolysis or apoptosis. So this is what a physical point of view. And after that, we have understood the mental aspect of this book. So the mentals of the Sora is starting with the consciousness and the working efficiency with the sensitivity, and that sensitivity leads to the inhibition in the form of anxiety, apprehensions, and everything. The base of psychosis is the fear, and that fear is not outwardly reflected. It shows in excess degree to form a projection. So that is what covered up fear. So there is a facades and covers, and everything is there. The base of that is the cowardice and the weakness inside. So it represents at the level of will, intellect, moral, attachment, sensitivity, and everything. So now we are reading the chapter 20 from this book, is the birth miasm. So this is what just a recap of the previous sessions. Now we are reading the birth miasm. As we all know that we carry a certain genetic code from the parents, and the everything which is governed by the genetic code, even our the physics as well as our psychological governance also based on the genetic code, and it is as a defense in the forms of either a constructive, either a destructive, or either a maintenance of our system. So, birth miasm. When an individual born, he inherited his natural trait and the characteristic from his parent. These are inherent in the genes. Not all genes are being deployed to give his individual a character. Some genetic traits are dormant and some are prominent. So all the depend upon which of the genes are not activated and which are activated. The activated genes produce or synthesize proteins which gives the individual a characters. For example, this is what the sirs given example that the father may be very tall, fat, round face, very hot tempered, and a psychotic individual. Mother may be soric, normal build, mild, timid, apprehensive individual. The child might take up the soric trait of the mother and have the same nature and the stature of the mother with a few properties from the father. This is the dominant miasm. Sora is in this child. This child will have a physical makeup, mental makeup, and susceptibility of the Sora, and hence it will be a Soric constitution. In a future, when this Soric defense is found insufficient to counter adverse circumstances, it is liable to change in the constitutions from the Sora to psychosis, as the dormant or the recessive trait of the father is there in their genes. In case of a lady who was predominantly soric with the timidity and anxiety dominating her nature, And if after marriage or after being deceived by the partner, she gradually becomes strong, positive, angry, manipulative, so that she has to survive the adverse circumstances and not let other take advantage of her. She may change the miasm or defense from the sora, the timid and anxious, to the psychosis, positive and manipulative, which can be in the same remedy. For example, leprosy is in a soric phase of the defense when suffering from the inflammatory disease of the respiratory tract, etc., will be timid, anxious, suspicious. But once it changes the defense mechanism to the constructive pathology, it switches its genetic trait to the manipulative, sly, positive, creative, more or less bolder than before to get its work done by hooks or hooks. With the obvious activations of the psychosis genes at the mental level, the physics also start reflecting the change to the obesity, rounded features, etc. So same things what sir is always say that the mind and body tell the same language. If the defense started at the psychological level or a mental level, the same defense has to be started at the physical level. And the same thing you have to counter when the you have looking to the physics is a psychosis, so same thing at the level of mind it can be shown. If the other dominant trait is syphilitic, the persons might change from sora to syphilitic type of personality. For example, legacies with extreme suspicious, extreme jealousy, hatred, malice, oversensitive to touch with the suffocative tendency, bleeding, destructive bluish pathology at the physical level. So this is what you have to understand that this remedy, every remedy has these three phases, the sora, psychosis and syphilis. Many of our remedy have all the three miasmatic representations in them. The mental and physical symptoms of respective miasm will be uppermost in the remedy when the individual has that effect defense. So, for example, the sulfur soric nature will be prominent during its soric or a physiological disease state. The sulfur psychotic nature will be prominent during the psychotic disease state. And so also about the syphilis. Thus, we have a soric sulfur, psychotic sulfurs, and the syphilitic sulfurs, materia medica. So this is what we have idea that in materia medica it was given that aversion to sweet and desire for sweet. So this is what something that we are confused that how the same symptoms to be given as aversion and the desire, or there are many symptoms that you encounter in each and every remedy in the repertory that something which opposes or contradict each other that symptom. So that is what something you have to keep in a mind that some in the person is in a soric state having this, in psychotic state there is something this, and in syphilitic state it is this. So we have to learn each and every remedy in tri-miasmatic way so that we can understand that how sulfur present in the soric state is different, how sulfur present in the psychotic state is different, and how sulfur present in the syphilitic state is different. Thus, we have a three type of remedy. Same is true with the aurum mat, lycopodium pulsatilla, and all other remedies. This is the base of trimiasmatic materia medica. Now, why this is important? This solves the questions of how and why the same remedy can be timid as well as courageous, mild as well as angry, dull as well as intelligent, active as well as inactive. So this quality are not just the polarity, but the defense or the miasmatic representations. It is not always that the constitutions in soric phase has to change to the psychotic phase of the same remedy. A soric sulfur can change to the psychotic complementary like a pulsatilla or a bryonia. So we have the same things that in an acute state something different, in a chronic state something different. So this is what you have to understand. If the genetic expression changes, that is the constitution changes, it has to go to one of the complementaries or relations of the previous remedy. So something you have to keep in mind that no a single remedy to be there for every individual for throughout the life. According to the adverse circumstances, he may change from one stage to another stage. So this is what you have to think in the form of complementary or relationship into the remedy. Psychotic and the syphilitic constitutions suffer from the soric disease that will reflect the birth miasm. The questions frequently asked is the coryza or dermatitis is a psoric manifestation, that is, the body is fighting with the physiological defense. A thuja, predominantly psychotic, or the nitric acid, predominantly syphilitic miasm, never suffer from the psoric disease like the coryza. This was the question, if it is in the mind. If yes, then should he be given a psoric remedy or a psychotic remedy? So this is what the questions in our mind. So every questions whether it is psychotic thuja or a syphilitic nitric acid has to undergo the first physiological defense mechanism. That is the inflammation when it is attacked by any of the virus or any of the external trauma. The birth constitutions may be predominantly psychotic, but he has to show the inflammatory response. The birth constitution may be syphilis, but he has to suffer from the inflammatory response first. When the first attack by the bacteria or virus, etc., but the reaction to the situation will differ in the psychosis and syphilis. So this is what you have to understand that everything starts with the inflammation as the physiological process. But if the dominant miasm in that birth miasm is psychotic or birth miasm is syphilitic, so this sora lasting for a shorter period of time, it may convert direct into the either a psychotic response or the syphilitic response. So here we have to understand the sensitivity belongs to the constitution, but the reactions belongs to the miasm. So the reactions comes after that is belongs to the miasm predominating in the patients. For example, if Thuja or natrum sulf suffer from the coryza and a cold, the symptom will be reminding us of a psychosis. The patient will not have a free-flowing transparent coryza of the sora or the irritability and the sneezing of the sora. The nose will be either blocked, snuffle, or there will be a excessive discharge from the nose. The discharge will be more of the yellow or greenish color, yellow color rather than the transparent. If the patient is predominantly syphilitic like the nitric acids or the Merck cells, they will still suffer from the coryza and cold, but discharge will be excoriating and bloody ozena. So if it is a diarrhea or dysentery, that too will be bloody. So this is what you have to understand, that the reactions, the sensitivity belongs to the constitution, but the reaction belongs to the miasm which is predominant in the patient. So if the miasm predominantly is psychotic, the reactions will be psychotic and the disease also represent the psychotic presentations. If the miasm predominantly is syphilitic, the disease also represent in the form of syphilitic reactive pattern. Even the aggravation time of coryza in syphilitic will be as usual night or sunset to sunrise, whereas in psychotic remedy will be aggravated at their aggravation time. So the consequences for the psychotic and the syphilitic will be the course of different. Thus, the thuja, natrum sal, pulsatilla, madorinum, etc. will, if the coryza is suppressed, develop thick nasal septums or the hypertrophy of turbinate in keeping with their psychotic or constructive trait. The mercuries or the fluorides or the bromides or the acid which have a predominant of the syphilitic destructive trait will further develop either a distortions of the nose, even the shape of the nose, or go into the destructions of the nasal cartilage. So this is what we have seen, that acute rhinitis, chronic rhinitis, and the atrophic rhinitis. Acute rhinitis represents the transparent discharge from the nose. The chronic rhinitis is represent with the thick indurative discharge with the thickening and hardening and chronic inflammations of the turbinates and everything. And the syphilitic atrophic rhinitis lead to the atrophy of the nasal mucosa, or sometimes there is a destruction of the cartilage leading to the deviated nasal symptoms. So this is what the distortions of the organs and the shape. So this is what you have to keep in mind, that you start with the sora and the patient presenting with the psychosis or the syphilis. Another example, the phosphorus, the sulfur. Phosphorus or a sulfur can be of any miasm. There can be a soric phosphorus, psychotic phosphorus, even a phosphorus syphilitic. Similarly, there can be a sort of soric sulfur, psychotic sulfur, and the syphilitic sulfur. It all depends on what were the inherited trait that predominate in the individual. If the inherited trait of a sulfur have been predominantly soric, then this man will remain in the Sora even up to the ripe old age. He will go on suffering from the skin rash, boils, and eczema throughout his life. So, sometimes if you found that the older people who having a chronic eczema since the 40 years, so that is what that was not reflecting, but this is what they imparted with the Sora. So, that is what you have to keep in a mind. These are generally lucky people. They will suffer from the minor psoriatic troubles like the hypertension, primary hypertension, it is called the stress hypertension, the stress diabetes, or a functional thyroid disorders, not going towards the destructions or the accumulations. If at an elderly age the patient comes to the physicians with the eczema, rash, or coryza, or a mild backache frequently, it is always advisable to make them aware that they are lucky to have such minor problem, and any attempt, if not proper with the proper simillimum, may be too dangerous. So this is what very important. When the older people come with the minor trivial ailment, sir always says advise the patients it is a lucky things, do not treat much. There was in the case of the man in his 50 who came with the complaint of long-standing burning in the stomach, diagnosed as the hyperacidity with the skin rash on the dorsum of the hands since long time. He was, after a long comprehensive history, prescribed lycopodium. The hyperacidity miraculously disappeared within the 8 to 10, making the patient very much appreciative about the homeopathy. The skin too started drying off, and the red discoloration disappeared and was replaced by the black pigmentation. This actually is the dangerous sign. The psoriatic manifestation was changing over to the precipitations of the excess pigmentations of the psychosis. This warning of the body was not heeded. The patient became a fan of the homeopathy. Within 1 month, he was free of two distressing symptoms, which the contemporary specialist had not cured for the 15 long years or more. In a fifth week, the patient suffered from the severe gastritis, upset, and the vomiting. His appetite had already slowly reduced. He was admitted for investigation and was found to be suffering from the jaundice. But the case was biliary duct carcinoma, which turned out to be a fatal. He was cured in 1 month and died in 2 months. The moral of the story is that let the sura be expressed in the least important organ like the skin or a respiratory tract as a soric functional organ at an elderly age and don't treat it. This is what very important of the understanding. At elderly age, sora has to keep into mind. Okay. Second, understand the language of the disease expression and change of the defense mechanisms of the SORA to psychosis or to the syphilis. So this is what guiding us that how we have to understand the presentations of the patient in this process. And last but not least, never be happy with the fast and rapid cures in a long-standing disease. They are most often than not gross suppression. So this is what we have to keep our eye open, that you have to take it into considerations that this is what important is. So this 3 point is most important in our practice whenever we are treating the disease in man. So in elderly patient, be sure that this has to be watchful. The mixed miasm. Very often, an individual might have predominantly the physical and mental trait of the psychosis and a few trait of the syphilis. This amount to the psychosyphilitic constitutions. If the traits are more of the syphilis, that is the destructive pathology, the destructive mentality, and a few traits of the psychosis. For example, slyness, deceitfulness, showmanship, etc. We can call these as syphilopsychotic constitutions or psychosyphilitic constitutions. Same is true with the miasm sora. Similarly, therefore, we can have a sauropsychotic, saurosyphilitic, or syphilopsychotic, or psychosyphilitic constitution. So this is the mixed miasm we have. Now, what is the significance of this? Determining the predominance of the miasm help us to understand the remedy or the simillimum as will be discussed later. So this is what very important understanding of our understanding. So there must be only three miasm, psora, psychosis, and syphilis, and sometime you have a mixed miasm of sauropsychotic, psychosyphilitic, or saurosyphilitic, or sauropsychosyphilitic. These are the three mixed miasmatic. So we have by Hahnemann has given a classifications of the dynamic disease, and in dynamic disease they have given two classification of fully developed disease and partial symptoms or one-sided disease. And in the fully developed disease, they are dynamic in nature based on the miasm, that is what psora, psychosis, and syphilis, the individual, and then he has given the mixed miasmatic disease, sauropsychotic, psychosyphilitic, or saurosyphilitic, or sauropsychosyphilitic. So this is what Dr. Vijayakar is also telling like this. So this constitution is representing us as a two trait. Then we have to think that this is constitution is sauropsychotic or this constitution is psychosyphilitic based on our presentations of the pathology of the patient. Now we have came across the additional miasm in our practice most of time. So what is the things about that additional miasm? So there is a lot of hue and a cry about the tubercular miasm and the cancer miasm, etc. There can be two possibility. First, the Hahnemann was right when he propagated that there can only be three miasm. Our theory of miasm as a defense confirmed Hahnemann's observation. And second possibility is Hahnemann was wrong and there are more miasm which Hahnemann did not think of in the first place. Could Hahnemann fantastic foresightedness ever have missed to recognize common disease like a malaria, tuberculosis, leprosy, typhoid, etc., having original tendency to cause disease and stamping them as a miasm? So this is what the two possibility we can think of. So for any theory to be given credence, it requires to stand the test of time, to have its base soundly placed on the firm ground of the science. And the third, even if it is a hypothesis, the theory should reflect the holisticity of the science, especially when it is holistic science like a homeopathy. This means it cannot be that the hypothesis is true only in the mentals or only in the physicals. Theory concern should make a given science easy rather than creating the confusion in the already complex science which has been misunderstood. So this is what anything which you have to learn, it should make you learning very easy rather than confuse you. So this is what very important, and it should be able to explain all the unexplained features of the homeopathy. So this quality is there. If this quality is there, then that theory is right. If this quality is not there, then the theory is wrong. So you have to understand that. So what Master Hahnemann is telling is that there are only a three miasm, no more than that is. So what was that? The Hahnemann stated that the miasm is at the root of all disease. This is reiterated and confirmed by the modern science. If the miasm is understood as a defense for the organism, the modern pathology confirms that all the disease pathology had its base in the defensive response to the stimulus by the cell. The defensive response are three only, which confirm with the Hahnemann's own idea of having only three origin of the disease. Besides the pathology of the disease mentioned by the Hahnemann, with the each Pigwards and Shankar again matches with the three basic defense of the cells, which gives rise to a physiological defense, a constructive defense, and a destructive defense. All the mental attitude mentioned by the Hahnemann and his follower match with the mentals deduced from the above defense on the mental plane. The theory of three miasm has thus stood the test of time for 200 years. Thus, the number of miasm being three is matched and explained with the help of modern research and hence has a confirmed ground of science. The theory of three types is reflected at the physical sphere, mental sphere, and the disease pathology sphere. Thus, this theory of the origin of disease conform to the holistic approach of homeopathic science. And after these explanations of the miasm being a defense mechanism, the relationship between the disease pathology and the behavior of the persons become very obvious, as already described in the previous chapter. Now, how the mental attributes of the sora, that of irritability and sensitivity, compare favorably with the inflammatory pathology in the physical aspect of the Sora. Hiding and multiplying attributes of the psychosis mind compare favorably with the hidden disease and the growth pathology at the physical level. The destructive and the perverted mentality of the syphilis compare favorably with the destructive and distorted pathology of the syphilis. So this is what the mind and body tell the same language. So if there is something at the cellular level as a destructive and distorted, at the same time the mind also has a destructive and a perverted mentality. Now we have the disease which is called as a tuberculosis. So we have the miasm, which is tubercular miasm. So the conformations of the tuberculosis, and so this is what we have to understand the pathology first, and the same way that pathology is reflected at the level of mind. So tuberculosis of the lung is a disease which at pathological level express in the three different stages. So something which is first start with the inflammations of the pleura, pleuritis or the lung at the onset of the infections with the tubercular bacilli. Second, the tubercle formations in the lung, and the third is the cavitations in the lung. So this is what the pathology of tuberculosis you can find. This shows that the defense mechanism is physiological and therefore soric in the stage 1. In a stage 2, the defense mechanism changes to the constructive defense, giving rise to the tubercle, therefore psychosis in the stage 2. And in the stage 3, the destructive pathology prevails to giving cavitation, showing that the defense mechanism is a destructive or a syphilitic in trait. Thus, the tuberculosis involve all three defense mechanisms and hence is a product mixtures of all three miasm. Hence, so-called the tubercular miasm is sauropsychosyphilis. These conditions can be more or less termed as a tubercular diathesis rather than the tubercular miasm, which is a misnomer. So this is what you have to keep in mind, that tuberculosis is not the tubercular miasm, it is a tubercular diathesis. The same is the case with the cancer. The cancer itself invariably starts with the irritations at the tissue level, proceed into the indurative phase or a growth phase, and terminate into ulcerations. Though the cancer is due to the genetic mutations, the pathology when expressed upon the body follow these three defense mechanisms, making it again a mixture of three miasm, namely sauropsychosyphilis. So this is what you have to keep in mind, that every pathology has to have these three defense only, not more than that three defense, and that is the reason why we have only three miasm, not more than that. So this is what we have understood up till now, the process of this miasm. So we have understood the birth miasm and then the understanding of the additional miasm. Additional miasm is no more any things, but it is something we have a three defense, and that is the only three miasm, sora, psychosis, and syphilis. So up till now we have understood the physical aspect of the body and defense at the physical level in the form of physiological, in the form of constructive defense, and the form of destructive defense. In terms of the disease also we have seen that in a physiological defense or a soric defense there is mostly the all its, starting with the inflammation. In psychosis there must be a four process called as the accumulations, deposition, synthesis, and proliferation. And in syphilis, we have seen at the physical level the necrosis and apoptosis or apolysis. Same way we have learned in the mental aspect. So we have to learn what was the behavior pattern of all these three miasm. So how the miasm is behave or how the person is behaving, and that behavior gives rise to a miasm. So you have to keep your eye, behave everyone, observe the behavior of everyone, and then you understand that this is behaving in a soric way, this is behaving in the psychotic way, this is behaving in the syphilitic way. So what was the behavior pattern of all three miasm? So behavior both on the physical as well as the mental plane will have a certain pattern. Now we have to understand how behavior starts. So we all have the idea of TFAB: thinking, feeling, actions, and behavior. So the thought is first, then the feeling is, then the action, and that action gives rise to a behaviors. So this is what the process, that behavior pattern at the level of physics as well as mind. So behavior will be influenced by the following property in the sora. So what was the sora? They are more sensitive, more irritable, hypersensitivity, anxiety, apprehension. These are the behavior, and the behavior is concerned with the daily work, need, and the normal activity. So this is what the Sora is. More irritable, more sensitive, more hypersensitive, more anxious and apprehensive, and this is day to day and needs. What is the psychotic behavior? The psychosis behavior will give rise to two states. One is psychosis excess and one is psychosis less. So in psychosis excess, everything is exaggerated. Everything is in excess. So there is the expression in excess. There is a deceitfulness, there is a slyness, there is a show off, there is a false show, and there is a pseudoism and the collective tendency. All are expressive in nature. Whereas psychosis less is something that underexpressed. So they are covering it, they are hiding it, so they are quietness, they are making everything secret, they become sly, they become a deceive, they make a deceptions, and there is a soberness and less of intellect and the moral and undercover. This is called as non-expressiveness. So this is what you have to understand the behavior in terms of this. So you have come across the child which comes always behind the mother, hide behind the mother, hide behind the furniture. This is what something that the psychosis less is presented. This child is a Baraita child. So Baraita has a miasm is psychosis less because they have a embarrassment, they have a timidity, they have a bashfulness. So this is what something that they have to hide themselves, they have to shrinkage inside. This is what psychosis less. And the syphilis behavior, the syphilitic behavior is something which we called as the behavior will be stamped as a destruction, distortions, or perversion and out of control. So you should keep watch in the out of control any of the emotions, any of the distortion at the level of will, any of the perversion at the level of intellect, any of the perversion at the level of moral, which gives rise to a syphilis. So you have to keep this word into mind that this behavior is not suited to the normal things. This behavior is not sane behavior. This is the insane behavior, and that is what you have to keep into mind that this is out of control, and that is a syphilis in this. So all these behavior pattern, as deduced earlier, are the defense mechanism at work, and this can be the basic natural trait inherited from the birth or developed and acquired during the lifetime. So this is what, unless and until there is a seed, it can grow as a tree. So this is what something it is there in the natural trait, then and then it is reflected outside as a form of behavior. So it can be a natural trait inherited from the birth, or it can be developed or acquired during his lifetime due to the trauma. So all the behavior pattern he developed. So whenever we are treating certain behavioral disorders, say for example the mental disorders, in that case you have to understand that why this person is behaving in such a manner, and that is what you have to keep the eye on that, and that gives you idea that how the person is behaving in this manner. So this can be a basic natural trait inherited, or it can be developed or acquired during the lifetime. So every individual defend according to his underlying miasm. All the emotions and intellectual are the defensively oriented and evolve. Thus, various traits of individual will reflect the miasm ruling him at that stage. So this is what something in a child, the person may be a soric or sauropsychotic. Sometimes the child may behave in a syphilitic stage also, but after the stage is over, child becomes so psychotic. So the psychotic trait is there. So this is what you have to understand that various state of an individual will reflect the miasm ruling him at that stage. So it is not something that every time the person remain in the soric stage, or every time the person remain in the psychotic stage, or every time the person remain in the syphilitic stage. So reaction to the situation will completely different in different miasm because the defensive method is different. So here I conclude one thing is that sensitivity is the constitutional rights, but the reactions depending upon the miasm which he has at that stage. Okay, so for example, Nux vomica, we all know that Nux vomica being a very angry remedy. So the in a stoic state, he was so much so irritable and angry and irritable and sensitive to noise and sensitive to external impressions. When they goes into psychosis, they have a more anger, or anger cannot be expressed as he is working in a company, multinational company. So he may goes into state of indignations also. And when this Naxoika becomes syphilitic in the state, so his anger goes into a state of rage and violence also, or he wants to destroy everything. So this is what you have to understand, that the reactions is based on the predominant miasm which is at that stage. So it can be a soric, it can be a psychotic, it can be a syphilitic, but the sensitivity to that is remain as a constitutions. So many rubric will be seen or expressed in a different light according to the miasm of the remedy. So for example, we have idea about the mischiefs. Now we have to understand the mischiefs. For mischief, the children are used to play mischief. The mischief is defined that the activity which might harm, damage, injure, or causing annoyance. The harm is more soric, damage is more psychotic, and injury is more syphilitic. So mischief, you have to understand the mischief in terms of everything. Okay, a child who tries to make a docile, benign mischiefs like hiding a pen or a handkerchief of his friend and maybe of a soric trait. So this is what the soric mischief he is doing. Those children or even adults who play a mischief which in long run may cause damage to one's prestige and maybe the painful, maybe a psychotic, or mischief done with the scheming and planning, hurting and causing damage but not really creating a destruction is also a psychotic. There was a child who placed a pin pierced through a cardboard, pointing upward on the seat of the school teacher, knowing very well that the teacher always sat on the chair with the force. When the teacher did so, it hurt him so badly, so as to give him pain and bleeding. This is called as syphilitic mischief. So here we have a one rubric and which can be classified into three category. How the behavior of that rubric in persons. So we have the mischiefs. Concealing or hiding important paper or the files of a person about to go for an interview may mean tension or distress for the concerned person, and especially when he does not know who has done it. This may mean a psychotic mischief, but in response to the situation, how the concerned person will behave also depend on his miasm. The Soric will become very anxious, start searching for the files, and if not found, will start weeping. The psychotic, while looking out for the file in anger, will go on thinking what alternative step he should take, and he will find a way out of this problem by manipulating or bribing his way instead of resetting the file in the interview, whereas the syphilitic may just lose hope and will let go the interview in utter disgrace. And the hysterical syphilitic may lose their temper to the extent of breaking and throwing things around in the frenzy or crazy behavior. So this is what you have to keep in a mind, that rubric can be triamiasmatic also. So the reaction base of that is also soric, psychotic, and syphilitic. The positiveness of individual who go ahead in the life also shows the miasmatic reflections. For example, the ferrum mat and the arsenic alb is a conscientious outweigh their other character to make them positive. They are the ones who will do their work meticulously according to the rules and regulations with all the paperwork nearly done so that there is no flaw and thus march positively towards their goal and acquire success. Whereas the shrewd planning, cunning mind of the Lachesis is the psychotic positiveness, or a Mercury or the causticum will find ways and mean to get over this obstacle. The same Lachesis, Mercury or causticum, if having a predominance of syphilitic hue, will blast their way through the troubles to achieve their goals. So this example of how every rubric itself have a different shade. Thus everything an individual does, thinks, or express can be seen in three different miasmatic expression. So this is what you have to keep your eye everywhere and make understand that why this person is behaving in this, why this person is behaving in this, why this person is uh, having this attitude based on this miasm. So this is how to look into considerations. So this is what every individual does, thinks, or express can be seen in the three different miasmatic expressions. So hope we conclude today's at this stage, and we will start the understanding of the tri-miasmatic materia medica, so that it will help us to understand how the person in the soric stage is defending, how the person in psychotic stage is defending, and how the person in cephalic stage is defending. This will give you idea that whenever the person comes to you with the certain pathology, either a soric, either a psychotic, or a syphilitic, so you have to keep your eyes and understand the man in the disease, so that you can understand this defense is working at that level. And when the miasm is shift, when the disease is also shift, you can understand that it is something that you have to keep your eyes. So for that understanding, we have to understand the materia medica in also a different way, and that is called a tri-miasmatic materia medica. So we will study tri-miasmatic materia medica from tomorrow onwards. So this is what the today's day and the concluding today's chapter. Okay, hopefully we will complete this book by the next week. So we will continue this series. And any questions up till now, let me know. Thank you so much. If you have any queries or questions, we will have a 5-10 minutes. So we will have discussions for 5 minutes. Otherwise, we will conclude the day today. Hope you have idea that how miasm is reflected. So every time you have to keep your eyes into is we have seen that Barretta carb is psychosis led, but when we see pathology, it is present in the cyst lipoma. Yes, there can be a psychosis excess also. So Barretta carb is a more of psychotic remedy, but the presentations is in the form of psychosis less, and there can be a psychosis excess also. All this because of there is an insecurity, and there is which we called as the cowardice or fear more pronounced in there. You have seen that Barata Carb having a behavior that is a very audacious behavior, and that audacious behavior is psychosis access, but he cannot understand that what was the consequences behind that, and that consequences may lead to the process called as a destruction of the cell. So this psychosis access behavior also goes in the form of indiscretion. So this is what you have to keep in mind, that how the psychosis is playing with all of us. So Barata curve can be a psychosis less, psychosis excess also. So psychosis as the base. Great. So thank you so much. We have a wonderful learning. Today is Vasant Panchami, day to worship Devi Saraswati. May she bless us all with the knowledge and wisdom, as Sir says, worship Saraswati and Lakshmi will follow. Yeah, absolutely. Always blessings. Nature always bless you. Once you are in the alignment with the nature, nature always bless you. Thank you. So we call the day today. Thank you all. Thank you so much. Thank you all. Nature bless you all abundance. Thank you.